I'd like to hand over to Dr. Sarah Bennet. Now, Sarah is the Deputy Programme Lead and Admissions Tutor at UCL. It sounds like you're a busy woman. Thank you so much for sparing the time to be with us today. Now, my understanding is that you've been doing a lot of research into approaches to create deeper learning. And as we build back and we think what parts of blended learning do we want to keep, we'd really love to hear from you how we can do that and what some of the answers are. What's been good about blended learning or online learning? So can I hand directly over to you, Sarah?
You absolutely can. Thank you very much, Ros, and thank you very much for inviting me to speak today. It's such a pleasure to speak to a group of like-minded people who are interested in this sort of area, and I've developed a significant interest of learning approaches over the last 10 years that I've worked at UCL Medical School. So as Ros said, I'm the deputy lead for the programme and I'm also the admissions tutor, so it has been a busy year in trying to plan and deal with constant change, which I think has been what has been so difficult for both us and our students. And our students really don't like change. And it's very difficult to bring the students with you when you're constantly on the hoof and you're trying to think about what might happen in the future. So about the learning approaches of our medical students at our university, which will then spread further. And I think the pandemic has really crystallised to me about how the learning environment really makes a huge difference to an approach that students will take. And over the pandemic era, we've been bombarded by students telling us that they've missed opportunities, that there's been variable clinical experience across all of their placements, that there's perhaps been unfairness or inequity. And it's always made me reflect on why do students feel like that? And it is often due to the outcome, isn't it? It's due to the assessment at the end. It is due to the fact that they feel disadvantaged moving forwards. And so how can we make that learning environment more inviting, more conducive to deeper learning in a setting that is going to be a bit different post-COVID? So that is the plan for my next 15 minutes. So I shall share my screen and hopefully that will work. So I've put here that this is the approach to success in a sense, and I hope that that's what it is, because as admissions tutor, my raison d'etre is to bring students into the medical school who are going to thrive on the programme and they're going to be successful at the end, that they're going to be doctors and contribute to society in that wonderful way. And so I hope that we can encourage that, and I think GPs hold all the keys in this respect. We get fantastic feedback from our students as well at UCL about their GP placements and how wonderfully they feel they fit into the environment and how they are made part of the team. They feel legitimate. They are participants in that learning environment, and it makes such a difference. And I think our colleagues elsewhere can learn a lot from that setting, and so you're doing an awful lot of the right things, but there are some other aspects that we can perhaps think about to make it just that little bit better. So I hope that at the end of this very short session you'll think about your own approach to learning, because we've thought just before about our own role modelling in this and how can we role model those approaches, some of the influences on learning. And in particular, I've mentioned the learning environment, but there are other things as well, and things that we can influence, and discuss how we can encourage those deeper approaches. Okay, so let's get a picture up there first. So I'm all about a bit of variety in teaching. We know that online teaching is a little bit tricky. We know that people don't like to put their cameras on and interact, and particularly when it's being recorded. And that is a question that I'm sure people will ask and is a very difficult one to answer. But I'd like you to have a look at this picture. So have a look at it, take it in. I'll give you 10 seconds. Okay, it's gone. So when you were looking at that picture, what were you thinking? I'm sure, like me, you're perhaps thinking, is there going to be a test? Is she going to ask me a particular question about this? What am I supposed to be doing? What am I getting out of this? What is the point? And in many learning situations, we're all thinking that. We're all having those thoughts about what is the point? What am I supposed to get out of this? What is the relevance? What is the outcome? And for our students, there is no doubt that there is a test at the end of this, is high on their priority list. So if I was to ask you now, how many coloured balls were there in that picture? Could you tell me? Anybody in the chat?
17.
17, thank you, Raj.
14.
I would say that again, shout it out.
14.
14. Oh, Lois, you knew 14. You knew what my question was going to be. And that's the thing, is that the students anticipate that too. They anticipate, what are we going to get them to do? Are we going to get them to do something that they don't know, something that's going to embarrass them, or is there going to be a test at the end of it? And that does affect the way that they learn. So consider that. When they're in your learning environment, consider whether they are thinking about what is the outcome to this, and can you guide them in that? So putting them in the environment where they're observing something, give them the task to do. So there were in fact 14 coloured balls there, but some of you may well have learnt that or thought about that in a different way. You might have thought, well, you know, I know that that's a picture of Kew Gardens and I've seen that before, so actually I remember that, and I remember that there are 14 balls there. So there is another approach to this, that repetition, that seeing things multiple times or recognising a pattern can also help with that learning. So hopefully you'll take that away and you'll have a think about that, and think about when the student is sitting in your clinic, what are they thinking and how can you guide that? So that's my first top tip as such. So thank you for that. So moving on. So I think that variety and involvement is a huge part of learning, and is a huge part of the way that we can really interact with our students as teachers. And so online, I've grown to love a bit of Mentimeter. So you might not have access to this, but you might have access to things like Slido, or to use phones, or to use the chat, use the whiteboard, to get students involved as well. So I'm going to ask you this question. What does learning mean to you? So if you can go on your phones or on your computer to menti.com, enter the code there, and then answer the questions that are on the screen ahead of you. And then hopefully that will give you the chance to think about, what does learning actually mean to you? So I'll get the screen up in a second when you've had a chance to look at that. I'm going to just stop sharing that. So I hope everybody has thought about that in a bit more detail. Let's share this. Whoa, look at that. Okay. So that's really interesting, isn't it? So quite a lot of you are focusing on the development as a person. Fantastic. A lot of you are being able to use that information that you've acquired. Brilliant. And that's exactly what medicine's all about, isn't it? Is that we want to be able to put what we learn into practice. And lots of you are putting about the meaningfulness of that knowledge. It's great to see that fewer of you are thinking about the remembering things well, because I think a lot of students think of learning as memorizing, of remembering facts. And again, a lot of our assessments are very much like that, aren't they? They push students to think like that. And building up knowledge and acquiring facts. Really interesting. So have a think about what your approach is, and how can you role model that to students? Because we all go to conferences for a really good reason, don't we? We go to conferences to learn, but to develop ourselves. And I think as we get older and as we go through our training, we learn in a different way. So that's interesting. So let's go back to the slides again. So thank you for that. That's really helpful. So there are different approaches to learning. So through my research, this is sort of my main theoretical perspective that I'm looking at. And you'll see there that that's from quite a long time ago. So in the 1970s, this research was happening and thinking about how do students learn. And Martin Salho came up with this idea of just getting students to read a passage from a book and then to think about a few weeks later, a test. So they didn't tell them there was going to be a test, but then there were different ways in which students approached that reading. Some approached it in a really in-depth way. They were thinking about the linkages in the paragraph, in the text, thinking about things that they'd learned before, had they read that paragraph before, and they were quite interested in it. So it was an interesting task. There were others that were very strategic about it. So they thought about how long did they have to look at it? What was going to be the assessment at the end of it? Why do I need to know this? And how am I going to be assessed on it? And then there were others that just felt that I'm not quite sure why I'm doing this, so I'm just going to memorize that text. Again, really interesting when I think about my own approaches and how perhaps I've covered several of those different approaches during my time. And sometimes I do revert to that surface approach if I just need to know these facts and I'm not quite sure why I need to know this because maybe I can look it up. And I think these days, a modern medical curriculum is very much about teaching students about where can you go to find these facts, because we don't, none of us keep the facts in our heads. We hope that we have the deeper understanding and the knowledge behind it, but there are some things that we need that surface approach for. But you'll see there that motivation comes up a lot. Interest in the subject, sense of achievement, but also fear of failure. And I do think that our students do fear failure quite significantly. They fear the exam and how it might impact their future career. And that's what we're facing at the moment in our curriculum. But I do really feel that the deeper approach is super important and we need to be promoting this. It's lifelong learning, it's self-regulated, self-reflective, and that's what's so important in healthcare, is that we're able to take that step back and think about what went well in this situation, what might I do differently. Those who adopt surface approaches have been found to perform less well, in fact, because they are memorising, and unless you have a photographic memory, that's quite hard. And workload and stress often mean that students revert to those surface approaches. And so by filling their time, by giving them little time for reflection and consolidation, we're pushing them towards that approach. And learning approaches can contribute to their academic success. And that's what we said at the beginning we want. We want them to be successful on the programme. So let's go back to Menti. Let's get involved again. What do you think? Going back to that slide, we talked about motivation. What do you think motivates our students to learn? So you can type something into there. I shall get up the screen again. Apologies for sharing and unsharing. Sometimes Menti does affect my my screen and makes me freeze, so I've tried to keep it separate today. What motivates our students to learn? Fun environment, I like that. Exams, 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 yes. Interest, the teacher, fantastic. And there definitely that comes across in feedback, doesn't it? Inspiring, role modeling teachers. A feeling of accomplishment that they have actually achieved something. And I think we can do more to find that sense of achievement in students. You know, at the end of the day, that debrief of what have you learned today? What have you got out of the session today? What have you got out of sitting in clinic today? A bit of curiosity, future career, I hope that motivates them still. A balance, situation mentors to be good doctors. Fantastic. Enjoying the topic as well. And that is a lot about the teacher too. That's really helpful. And you have already thought about this, which is fantastic. So thank you very much for that. Okay, moving back to my slides. So can we influence students' approach to learning? So I think we can as teachers. that there are several things that we can do, because what influences learning is not only the individual, but the outcomes of learning. What does it mean to them? What is their motivation for that? So the interest, the role modeling, the assessment, and society and the learning environment itself. So what are the pressures that are on the students to take part in learning? And so during my research, I came up with this, that the interest and motivation of the learner are super important, but there are all these other factors that we need to take into consideration. The competitiveness, social media factors, the ability to actually self-regulate their own learning and think about what do they need to do to improve. The learning environment itself, about the curriculum, the assessment, the teaching, and the outcomes, qualifications, prizes, job prospects, patience. And I really hope that we can again role model that patience is so important as an outcome. And we've already commented how much joy patience can bring us. And I hope that as GPs we can role model that and show that patients are at the centre of our care. So how can we help? So I think, and I've mentioned it a lot about role modelling and about how we can show that learning approaches and deeper approaches to learning and understanding are really important. And we can talk to students about that. We can provide guidance and support through their working day. We can do that debrief at the end of the day to ask them what they've learned. And I think an apprenticeship is so important. We've moved away from that quite a lot, and we're trying to claw it back. An apprenticeship is observing, learning from others, learning from your work environment. We can guide their observation. There are often times when students are sitting in the corner, aren't there? Or times where they're sitting with other healthcare professionals. How can we guide their learning in that environment? And we've talked obviously about blended approaches as well. Now, an apprenticeship is learning through and from work. So what can we do? And I've mentioned some of those already, but I want to focus on the one right on the right-hand side there, the empowerment and agency. I feel strongly that students need to feel empowered. They need to have the agency for change. They need to know that their opinions are valid. They need to know that you are listening to them and that you're changing or shaping their placement to help with their learning. So asking them right at the beginning, what do they want to get out of this, is a very simple way to give them that empowerment, give them that agency. And we've talked a little bit about a blended approach. So that is the way that we're moving forwards at UCL next year, that a blended by design approach is being achieved. So there will be a lot of face-to-face interaction, and we are moving back towards that. It's what we all want, it's what we appreciate, it's that social learning aspect that we like. But the blended approach, by having some time to consolidate and reflect, are so important. As Radha just said, the time to think about that kindness and joy helps to provide that space. Making the most of clinical opportunity when it's there, so that they are getting something out of that time, so that then when they're elsewhere or they're doing something remotely or online, it becomes important. And online learning can provide that additional context. And provide you with extra case studies and the chance to talk through learning that they have done. And joining sessions remotely helps them to join from elsewhere. There is no doubt travelling miles makes a difference, doesn't it? And going out to remote places can affect their learning. We know that that's at the very base of Maslow's hierarchy of needs, of thinking about students and their environment is so important. So it's a quick race through, but I hope that I've given you a little bit of a thought process through my presentation of thinking about your own learning and your own approach, and as an approach as professionals in this environment, as lifelong learners, continuous professional development, and how can we foster that in our students as well. I think we need to consider what influences learning, and to make sure that we are considering that when we are talking to our students and setting out tasks. And I hope that deeper approaches to learning can be fostered in the learning environment by thinking about the debrief, thinking about the apprenticeship, the observation, and providing some space for students to have agency and opportunity. So I hope that's helpful. I hope it might have stimulated a bit of thought and conversation, and very happy to take some questions at the end of the session. Thank you very much.
Thank you so much, Sarah. So much to think about. And yes, please put some questions in the chat.